We're just having a love fest going on over here. All of us, I was thinking about all my great times at the University of Virginia. I do have the blue. I don't wear the orange, though. That would not be allowed in my state. It's all about the big blue. But many of the community-based research bringing in with my tobacco cessation clinics that we had there in Charlottesville using mindfulness. So it's just really great to see all of these connections and just having this wonderful audience of Highland and American and certainly UVA students. So I'm the Dean of Nursing at the University of Kentucky, and it's really my pleasure to be here. And I'm coming to you and sharing some words from my perspective as an educator, as a nurse practitioner, and as a researcher. As you've been hearing, I'm here today because of many of the other stories of individuals that are here. Loss of family members to cancer, and those transformational moments that continue to drive my passion for tobacco control. I remember my mother being a beautiful smoker. She was probably a 1-pack-a-day smoker. She had long, slender fingers with beautifully polished nails. And her fingernails were nice and long, and she would smoke Salem menthol cigarettes, and she would blow these beautiful, cool, rings, these smoke rings, and I was just, mesmerized by that. My father, on the other hand, was an ugly smoker. He probably smoked 2 packs a day, and I can vividly remember that he would just wake up every morning literally hacking up his lungs as he was lighting up his Winston cigarettes. And he would do that before he even put his feet on the ground. My mother died of a brain tumor when I was 10 years old, and my father died from metastatic lung cancer when I was 36 years old. As a nurse, I knew the detrimental health effects of smoking and tobacco use. Yet, although I was too young to have the tobacco conversation with my mother, I wasn't too young to have the conversation with my father. In fact, I never did. I had been a nurse for 16 years when my father died, and I never once said, "Dad, have you ever thought about quitting?" That's not what you do when your father, who was a field artillery Army officer who served 2 tours in Vietnam, some things you just didn't do. You just did not cross that line. So when he died, I promised myself I would start a lifelong journey of having the tobacco conversation in all walks of my nursing practice, in classrooms, in clinics and hospitals, in communities, at legislative tables and at board tables, providing tobacco treatment providing treatment to help those quit that are tobacco dependent, promoting tobacco use prevention, and advocating for resources and policies to better protect the health and well-being as others. And I'm doing that to this very day. I've been nursing now for 40 years. I thought I was in the belly of the beast at Virginia, but going to Kentucky, that's really the belly of the beast, and where the land is rich, and thinking that we are other than basketball or bourbon or about the Kentucky Derby, our rankings aren't so good. When you look at Kentucky, we're up there 1 or 2 every year. Just depends on who's running the numbers and what time of the year for having the highest smoking rates in the country. So during my nursing career, I've come across a lot of heroes that have helped shape and influence my thinking with tobacco control, and also certainly my passion. But my very first hero was the Surgeon General Everett Koop, because it was over 50 years ago where he came out with the very first report on smoking and health. Back in 1964, he literally shocked the country that 42% of our population smoke. And today that prevalence is 18%. Now that may sound a lot better, it certainly is, but that's still too many. That's 42 million, and almost 500,000, as you heard earlier from Bill, die prematurely, unnecessarily from tobacco use. And that costs us about $300 billion a year, whether that's indirect cost or direct cost. Today, my new hero is also a Surgeon General, and it's our current Surgeon General, Vivek Murthy. And he came out 2 months ago with the very first report on electronic cigarettes. So listen up. Listen up. This is the population, this is the generation that this report is about. It's about electronic cigarette use among youth and young adults. We finally have data and ammunition to help stop the debate that e-cigarettes are harmless. Instead, this report lays out in clear, indisputable terms that e-cigarette use is a risk to the health of young users. That includes nicotine addiction, harm to brain development, and we need you to be smart now, okay? We need you to be smart. Increased odds of future use of tobacco products, and that's a real concern of mine. And although not specifically addressed in the Surgeon General's report, we know that electronic cigarettes cause disfiguring injuries from shoddy manufacturing and those malfunctioning batteries that are in those electronic cigarettes because we do not have the regulation we need for our electronic cigarettes. So they're officially referred to as electronic nicotine delivery systems, ENDS, E-N-D-S, and these devices resemble literally a cigarette and typically deliver nicotine and harmful compounds as propylene glycol, which is nothing more than antifreeze, and formaldehyde. And that's just to name a couple of toxins that have adverse health effects and carcinogenic effects. E-cigarettes are also known as e-hookahs, mods, vape pens, vapes, and tank systems. E-cigarettes are battery-operated devices that heat and come in over 100 flavorings, including bubblegum, Fruit Loops, and chocolate raspberry. According to the Surgeon General report, e-cigarettes are now the most popular tobacco product among American teens. And e-cigarette use, now listen to this, we're going to have a test afterwards, see if you're paying attention, everything we're saying. E-cigarette use by high school students grew by 900% between 2011 and 2015. It started out 2.5%, now it's up to 16%. And that's just talking about those that have used electronic cigarette in the past 30 days. When asked, high school students and young adults, 18 to 24, have you ever used, over 70% say that they have. Now, back to these startling numbers about the use of e-cigarettes with electronic cigarettes. This surpasses traditional cigarettes, and it is the #1 preferred product. And now we also know that not only is it the #1 most preferred product, but it's associated with dual use of combustible tobacco products. So whether that's a cigarette or a cigarella. In 2015, almost 59% of high school students report being an e-cig user plus a cigarette or a cigarillo user. In closer review of the youth data on e-cig use, older students, the ones that use it are the following. Older students, meaning the high school students versus middle school, Hispanics and whites are far more likely to use e-cigarettes than younger students and blacks. The most commonly cited reason for using e-cigarettes is curiosity, the flavoring or the taste, and the perception that they are less harmful than other tobacco products. Inside many electronic nicotine delivery system is the liquid poison nicotine. Not only is it highly addictive, but also places youth health at risk because the brain is still developing until about age 25. So research has shown exposure to nicotine while young can cause lasting cognitive and behavioral impairment, such as disruptive development of attention, as well as learning, and increased susceptibility to addiction, meaning with other substances. Research has also shown nicotine is harmful to pregnant women and fetuses, including the risk of sudden infant death syndrome, SIDS. Even in tiny amounts, whether ingested or absorbed through the skin, liquid nicotine, those devices can break, and when you're putting them together, the nicotine bottle can break, and it can certainly cause, when you're absorbed through the skin or inhaled, can cause severe vomiting and seizures, and even a single teaspoon can take a child's life. Although the e-cigarette safety caps legislation was passed last year, that was really great. The industry would like us to believe their support of that bill has to do with preventing kids from being poisoned. But they actually have another agenda. The industry is intentionally targeting kids, not adults. Why do you think they have Fruit Loops? Why do you think they have buttergum flavoring? The CDC reports that in 2011, $6 million was spent on advertising e-cigarettes. And in 2014, it was $115 million. That's 2 out of 3 kids are seeing these cool ads with cool flavors. This is a $3 billion year industry that is repeating the playbook from their earlier years of marketing the safer cigarette. The generation of promoting the lights is now promoting a generation of the vapes. Action is needed for states to include e-cigarettes in their comprehensive smoke-free workplace laws, as 9 states and the District of Columbia, which I'm really happy, they have already done that. My state has not. My state in Kentucky continues to be on the F list from every national organization possible. The American Lung Association just came out and gave us Fs in every category having to do with comprehensive tobacco control and prevention strategies. So, like I said earlier, in a state that prides itself for national basketball championships and earning top academic ranks, we have a lot of work to do to get off these top rankings for death rates from cancer. Every year, 10,000 lives are lost in Kentucky. We have the highest lung cancer rates in the country that strike and take the lives in Kentuckians at rates 50% higher than the national average, and that's just lung cancer. Unfortunately, our death rank in the top 10 nationally for breast, colorectal, and cervical cancers. Each of us in this room has a story, and the timing could not be more urgent for us to be stronger advocates at the local, state, and national level to better promote the health and well-being of others. It was easy to miss among coverage of the recent U.S. presidential election that on the same day that Donald Trump became our president, the state of California voted to increase tobacco tax from 87 cents per pack to $2.87. That was its first increase since 1999. Nationally, signs are ominous for tobacco control, so we must work harder and be more focused on actions that we can control that will have the greatest public health impact. Recognizing that our state administration in Kentucky is not looking hopeful for passing any tobacco control legislation, we instead are rallying our local efforts to increase tobacco taxes in Lexington, Kentucky, because we know that research shows us for every 10% increase in the price of cigarette taxes, it will reduce the consumption by 4% among adults and 7% among youth. Tobacco takes a tremendous toll on our health and our economy. Millions of lives are impaired unnecessarily, and billions of dollars are spent. Regardless of our national, state, or local political climates, we can and must work together to ramp up our game plan, full speed ahead, to better protect public health. We can and must do better. Raise taxes, include e-cigarettes in our ordinances, allocate funds to support educational and treatment initiatives, and pass comprehensive smoke-free laws in public and workplaces. It is not until we are more vigilant to promote healthier lives that we will be able to breathe healthier air and live healthier lives. Thank you.